All right. So one of the things we do here in the office is frenectomies, or what we call tethered oral tissue, or TOTS. So right here, we're going to try and just do a quick overview. If you guys want a little bit more in-depth discussion about the tongue ties, check out our webinar that we have on our webpage. So just to give you guys a quick overview, what is the tongue tie? Well, this is a pretty good picture here of an infant that actually has a tongue tie. You guys can see it right here. You see the dip in the tongue. And why is this important? Any of you ladies out there who have given birth and have attempted to breastfeed and it's been uncomfortable, or if it's been difficult, or your child has had a lot of gas, uncomfortable breastfeeding, this is typically the reason why that's happening. And so what we do here in the office is we actually do what we call frenectomies. Simply stated, we take a laser and we laser that connective tissue right here, the frenum, and we allow that tongue to release and to properly function. So what we use here in the office is a light scalpel CO2 laser. And I actually have a wonderful video from Dr. Richard Baxter that can actually show you guys the procedure. So this is a classic example here, actually about how long the procedure itself takes. It's about 30 seconds. So we start here, he's doing the lip tie, and you see this laser is just vaporizing that tissue very nicely. Now, those of you at home, I'm sure you're asking yourself, well, does the child feel pain? Well, infants have different nerve endings than we do, so their level of pain is much different. This laser is actually relatively gentle, but it is an uncomfortable procedure for them, but you can see just about how quick that was. That was about less than 15 seconds to get that done. Once the procedure's over with, we allow our moms to breastfeed as long as they need to. The infant will soothe by breastfeeding. So now Dr. Baxter here is going through the tongue, and you can see the frenum right down here. And he's going in and lasering it. You just see how that CO2 laser just vaporizes those water molecules inside of that frenum, and just about how quickly this is done. And you can see he's almost finished up here. This is exactly how we do it here in our office. Same laser, same procedure. And you can see just how much more open that area is. So that has a lot of benefits for the infant. You're going to be able to breastfeed a lot better. That tongue's going to be able to sit up in the palate a lot more, which will help with skeletal development over time for that infant. And I get a question a lot about, hey, what happens? My baby's feeding just fine, but what do we need to do it now, or should we wait? Well, if you don't wait, there's actually a way. You'll actually have this your whole life, and I can show you actually what an adult looks like with a tongue tie. So you may say to yourself here in this first picture, this looks like a normal tongue. This is actually what we call a class 3 tongue tie. So this tongue tie actually attaches right at the midline of the back of the tongue here. And while the tongue can move relatively well, you can see there's still some restriction. That tongue should be able to touch all the way up to the back of the front teeth pretty easily here. So there is some restrictions here. Now in adults, what you will notice, some of your symptoms, one of the number one things that we notice is either a strong gag reflex or having a lot of neck and shoulder muscle tension. Now, you're saying, Doc, what does your tongue have to do with neck and shoulder tension? Well, this is made up of connective tissue. Your connective tissue is all one unit inside your body. If you've seen guys that like to do a lot of arm workouts but don't do anything else, they can't stretch their arms out, and that's just because the connective tissue is so tight in that area. It's hard. They need to release that connective tissue. Now in your neck and shoulders, the tongue tissue, the connective tissue here is very tight. It's going to put pressure on that connective tissue in your neck and shoulders. When we release this, we see patients that have very noticeable decreases in their neck and shoulder tensions. So much so that a lot of times when men get this procedure done, it's quite a euphoric experience because men don't really realize how much tension they're carrying. And we've had several people that have actually passed out in procedures, and we actually have a protocol to prevent that now. One of the big things you can do is make sure you eat a good breakfast or a good meal before you come in. And if you're a male, you will be hanging out in our office for probably about a half hour after your procedure, just to make sure everything's good to go. It is something that we find that's quite interesting. But this procedure here, you can see, they started off here with this very tight frenum. They lasered it with a light scalpel laser. You can see just how clean that is. I know it doesn't look clean to you at home, but from a dental standpoint, there's not a lot of bleeding here. That's actually a very clean wound. And then with some stretching and usually some myofunctional training or exercises to stretch the tongue tissue out, you can see just what a difference there is here in terms of just the movement of the tongue. And I guarantee that this patient has a lot less neck and shoulder tension here. So this is a pretty good example of an adult. Obviously, they come in all different shapes and sizes. If you're interested, please come in for a consultation. And like I said, if you want a deeper dive into tongue ties, please check out our webinar.